From Wednesday, the government has declared a 2-week special emergency care period during which pay will be raised for physicians to help address hospital staffing shortages for the Chuseok holidays. And ahead of the holiday, also announced were plans to stabilize the supply of rice and beef on the market to tackle price concerns about these items. An Israeli strike on a humanitarian zone in Gaza has reportedly killed at least 40 people and injured 60 others. It's September 10th, 6 p.m. in Seoul. This is Newscenter. Thank you for joining us. I'm Yoon Jong-min. Starting tomorrow, the authorities plan to take extra care in ensuring emergency medical services are available for the upcoming Chuseok holiday. President Yoon says more local hospitals and clinics will be open while doctors will temporarily get higher pay. Our Kim Do-yeon starts our coverage.
Amid concerns over the long holiday straining the nation's already hit emergency medical system, President Yoon Suk-yeol on Tuesday said the next 2 weeks will be the Chuseok holiday emergency medical period. This came during a cabinet meeting to ease the public's concern over access to healthcare during the 5-day holiday.
추석 연휴 기간 국민 여러분께서는 정부의 안내에 따라 주시면 걱정 없이 의료 서비스를 받으실 수 있습니다.
First, he said there have been more local hospitals volunteering to open during this year's holidays than in past years. According to the Health Ministry, the number of hospitals expected to open during this period is twice as many than the last Seollal or Korean Lunar New Year, which was around 3,600. This is expected to ease the burden of emergency rooms across the nation, as President Yoon urged those with mild symptoms to find these hospitals or clinics to get checked up. For those looking for an open hospital, they can dial 129 or visit the portal called eGen or use the Naver or Kakao Map functions. He showed appreciation to these hospitals and those in the emergency rooms who will continue to work.
정부는 의료인들의 헌신에 조금이라도 보답하기 위해 추석 연휴 전후 한시적으로 진찰료, 조제료 등 건강보험 수가를 대폭 인상하기로 했습니다.
In fact, the government will increase the consultation fees for specialists at regional emergency medical centers who are particularly responsible for critically ill emergency patients to 3.5 times the usual rate. In addition, to reinforce the insufficient workforce, the government will prioritize the deployment of available personnel such as military doctors, public health doctors, and medical support nurses. According to the top office, the finance minister reiterated during the meeting that 3.7 billion Korean won, or around $2.7 million will be put in to make sure more medical staff could be deployed. As he wrapped up, the president didn't forget to thank those who would not be traveling to their hometowns due to their duties, such as soldiers, firefighters, police officers, and emergency medical workers. He called them the true heroes that uphold the society. Kim Do-yeon, Arirang News.
Meanwhile, this afternoon, the government unveiled its plan to inject funds worth over $5 billion to improve education at medical schools, in line with its plan to increase the number of new medical school students. Our Chuseok with the details.
The government has revealed its plans to provide support for medical schools following their increased enrollment quota. According to the announcements from the Education and Health Ministries on Tuesday, starting next year until 2030, more than $5 billion will be provided in financial support. Improving education conditions will mainly focus on areas to match the increased number of students. In particular, the plan is to make national university medical schools into regional hubs. Over 3 years starting next year, 1,000 additional medicine professors will be hired by national medical schools by utilizing retired professors in emeritus positions. Materials necessary for basic training, such as microscopes and dissection tables, will also be provided. Also, schools will receive financing to remodel facilities and increase classroom space due to the expanded quota. The law will be revised to prioritize cadaver allocation to medical schools due to fewer donations. By 2028, clinical education training centers will be established in all national university hospitals, allowing students and residents to receive systematic education. The proportion of local students admitted to 26 universities outside the capital region will gradually increase, reaching about 62% by 2026. Moreover, next year, the allocation of residents to non-capital regions will be increased to 50%, ensuring that residents from local medical schools can train and settle in their regions easily. However, since all of this is based on the early plan to increase enrollment by 2000, it may change depending on discussions within a joint consultative body proposed by the ruling party. Chuseok, Arirang News.
Also, ahead of the Chuseok holiday, the authorities are trying to stabilize the price of domestically produced rice by controlling its supply. Some long-term goals were set for the modernization of beef production as well. Our Lee Si-hu has this report.
As we face one of the biggest holidays here in South Korea, perhaps a major concern for many is the price of groceries. To ensure that the nation's farmers and consumers can all enjoy the Thanksgiving celebrations free from money worries, the government, the ruling party, and the agriculture and livestock industries are set on stabilizing these prices, especially for two South Korean staples, rice and beef.
We are set on stabilizing rice prices by setting aside the surplus from this year's harvest. First, we will set aside 20,000 hectares of rice cultivation areas immediately to prevent overproduction.
Representative Kim explained this is to prevent more of an oversurplus from entering the market. In addition, the government and farmers will work together to enhance rice quality to increase consumer demand, which has decreased year by year recently. Meanwhile, more long-term goals are being set for the domestic beef production industry.
We will strengthen the domestic beef industry by improving the current high-cost, long-term production process, so there is no more recurring anxiety about its supply and demand.
The plan is to help farm owners build so-called smart cattle stations, equipped with technologies to help with production efficiency. Furthermore, the government will provide extended financial support and look for more fair distribution channels. Meanwhile, the government is working to increase the supply of other grocery items, including cabbages, apples, and pears, typically enjoyed in Korea's autumn months. Lee Si-hu, Arirang News.
Israel struck a humanitarian zone created to shelter displaced Palestinians in southern Gaza early on Tuesday local time, killing at least 40 people. Cha Eun-kyung has more.
At least 40 people have been killed and 60 injured in an Israeli early morning strike on a humanitarian zone created to shelter displaced people in southern Gaza, according to local rescue officials, in what Israel said was an attack on Hamas terrorists in the area. Gaza Civil Defense spokesman Mahmoud Basal said Palestinians in the area were not warned of the strike in advance, adding that ambulance and civil defense crews have been mobilized to the site and there is talk of a large number of killed and wounded. At least 4 missiles hit Al-Mawasi, a coastal region in Khan Yunis, where hundreds of displaced Palestinians had fled to, many living in tents in an area with sparse infrastructure, according to Reuters. Local rescue officials from the Gaza Strip reported that about 20 to 40 tents were destroyed in the attack, leaving craters with a depth of at least 9 meters. Emergency official Basal said that teams had been struggling to search for victims who might have been buried. Israel admitted launching the airstrike in southern Gaza. The Israel Defense Forces said that it struck significant Hamas terrorists who were operating within a command and control center embedded inside the humanitarian area in Khan Yunis, Gaza. The IDF has blamed Hamas and other militant groups in the Gaza Strip for continuing to systematically abuse civilian and humanitarian infrastructure, including the designated humanitarian area, to carry out terrorist activity against the State of Israel and IDF troops. 차윤경, 아리랑 뉴스.
North Korean leader Kim Jong-un says his regime will increase its number of nuclear weapons exponentially, blaming what it calls the U.S.-led military bloc. Against this backdrop, South Korea, the U.S., and Japan today held defense talks. Our North Korean affairs correspondent Kim Jong-sil reports.
North Korea's Kim Jong-un emphasized his regime's commitment to strengthening its nuclear capabilities. He said the North was carrying through policies to exponentially increase its nuclear weapons as a crucial measure to safeguard national sovereignty and security interests, according to the state-run KCNA on Tuesday. At a ceremony marking the 76th anniversary of the founding of the DPRK on Monday, Kim stated that North Korea will continuously enhance its nuclear capacity to counter any threatening actions by nuclear-armed adversaries. He criticized what he described as the reckless expansion of the U.S.-led military bloc, calling it a significant threat. Meanwhile, South Korea, the U.S., and Japan held their 15th defense trilateral talks in Seoul on Tuesday. The three countries released a joint statement condemning Pyongyang's recent diversification of its nuclear delivery systems and tests and the launches of multiple ballistic missiles. The three sides reaffirmed their commitment to strengthening trilateral cooperation to contribute to peace and stability on the Korean Peninsula, in the Indo-Pacific region, and beyond. They also agreed to hold a second trilateral multi-domain military exercise known as Freedom Edge in the near future. The first Freedom Edge exercise took place in June. Regarding Kim's remarks, an official at the South Korean Ministry of Unification told reporters on Tuesday that Kim's message was notable and that he avoided directly referring to South Korea as part of the U.S. and its followers. The official said this is because the speech might have been intended more for a domestic audience. Kim Jong-sil, Arirang News.
High-level delegations from around the world have declared that decisions regarding nuclear weapons should be controlled by humans, not AI. On Tuesday at the REAIM Summit, a platform for global discussions on the responsible use of AI in military applications, participants adopted a blueprint for action that outlines guidelines for responsible AI governance. They emphasized the need to prevent AI technologies from being used by nations or terrorist groups that contribute to the proliferation of weapons of mass destruction. They added that strong security measures are crucial to prevent the misuse of potentially dangerous AI-based military systems. South Korea, a co-host of the summit, plans to push for further discussions based on the declaration at the United Nations. U.S. presidential candidates Kamala Harris and Donald Trump will face off in their first televised debate on Tuesday local time, amid recent polls showing the two candidates racing neck and neck. Lee Seung-jae tells us more.
The televised debate between U.S. President Joe Biden and former President Donald Trump was the catalyst for the incumbent dropping out of the race. That led to Vice President Kamala Harris running as the new Democratic Party candidate. And another showdown is set to take place on Tuesday, as Harris and Trump will meet for their first televised debate. Hosted by ABC and moderated by David Muir and Lindsay Davis, the debate will last for 90 minutes. Taking place in Philadelphia, the two will square off on key issues like the economy, immigration, abortion rights, crime, and foreign policy. With the two candidates neck and neck in recent polls, the televised debate is expected to give a much-needed push to convince swing voters one way or the other. Trump is likely to blame high inflation on the Biden administration and its clean energy expansion policy. Harris is likely to counter by presenting her economic pledges to reduce the burden of inflation on the middle class, while slamming Trump for looking after the rich. The two will also lock horns on immigration issues and abortion rights. And following a recent school shooting, pundits expect gun control might also be brought up. And all eyes are on how Trump will respond, given the assassination attempt on the former president. As for the rules of the debate, the mics will be muted while each candidate takes their turn to speak, despite a request from the Harris camp to have the microphones open at all times. The debate will begin with questions from the moderators with no opening statements. Harris and Trump will, however, have a chance at the end for a 2-minute closing statement. 이승재, Arirang News.
In Vietnam, Typhoon Yagi struck the country over the weekend, claiming at least 49 lives and leaving many people missing. Yoon reports.
What is said to be the strongest to hit Vietnam in decades, Typhoon Yagi devastated the country over the weekend, sweeping away buses, sinking boats, blowing down thousands of trees and tearing roofs off buildings.
In my entire life, I haven't seen a typhoon with this brutal winds. Very strong. It has knocked down many trees on the streets. I have to temporarily be under the shelter, under the bridge.
On Monday, a major bridge in northern Vietnam, the Phong Chau Bridge, collapsed, causing cars to fall into the river below. Over 10 people are still reported missing from the bridge collapse. Deaths from the typhoon have risen to at least 49, and over 20 people are still missing. This is according to the local government as of Monday. Deaths have continued to rise in the aftermath of the typhoon, including from a landslide triggered on Saturday.
I've lost everything. There's nothing left. When I look around, people have also lost all they had, just like me. Even though I'm sad, I can talk about it because it's not just me who is suffering. I can only try to recover from this.
The typhoon cut power to millions of households and companies and severely damaged infrastructure. The walls of a South Korean LG Electronics factory collapsed in Haiphong, northern Vietnam, causing significant damage but no injuries to employees. LG Electronics said that refrigerators and washing machines were floating in the floodwater. Although Vietnam's meteorological agency downgraded Yagi to a tropical depression on Sunday, it cautioned that there is still a high risk of additional flooding and landslides as the storm moves westwards. Typhoon Yagi, one of the most powerful storms to hit Asia this year, also caused significant destruction in China and the Philippines before reaching Vietnam. Yoon, Arirang News.
Over in the U.S., wildfires in the southwest of the country are growing rapidly amid a heat wave that has pushed daytime temperatures up to around 38 degrees Celsius in the region. Californian fire authorities have said that more than 8 billion square meters have burned across the western U.S. since the fires started on September 5th. The line fire, which started in San Bernardino, east of Los Angeles, is forcing around 5,000 homes to evacuate. About 1,000 firefighters have been deployed, but the fire is only 3% contained. California has declared a state of emergency in the area and is sending various resources to minimize the damage. In other news, in a world often dominated by its sleek, modern architecture, a centuries-old Korean tradition is capturing global attention. In line with this, a unique educational program is helping to preserve and promote the ancient art of Hanok construction. Our Moon Hae-ryun went there to take a look.
Hundreds of small, carved wooden blocks fill this room, all in various stages of completion. It may not look like much now, but they are the building blocks of Hanok, a style of traditional Korean architecture beginning to gain traction globally, thanks to its unique characteristics that set it apart from Western-style buildings in the modern day. Jeonbuk National University's Gochang campus offers a wide variety of Hanok education programs that range from a hobbyist course to a 4-year undergraduate degree, funded by the Ministry of Land, Infrastructure and Transport in an effort to conserve Hanok culture. Students come from a wide variety of backgrounds as a result, including this group of students who are learning how to build ondol, an underfloor heating system, and how to apply clay to walls. They're all professionally trained architects wanting to integrate Hanok elements into their work, and 2 months into the course, their perspectives on Hanok are changing.
I used to think of Hanok as just houses that people used to live in back in the day. But since I began this course, I realized it's more complex and worth studying in depth.
Another key aspect of Hanok architecture is that it can be built and then taken apart again like Lego blocks. This is possible because these buildings don't use nails but interlocking pieces to keep the structure sturdy. And students are able to build pavilions like this before disassembling them to donate to disadvantaged communities or public institutions to be reassembled on site.
As you can see behind me, students are busy learning techniques that are essential for Hanok building, especially woodwork.
Wood and soil are the primary materials that go into building Hanok, making traditional Korean architecture eco-friendly and sustainable. As current global architectural trends are centered around sustainability, Hanok is an attractive building model overseas. The university exports Hanok to many countries around the world, including the likes of Vietnam, the Philippines, Algeria, and the United States.
The most rewarding aspect of teaching the program here is when people overseas recognize the beauty of Hanok when we export Hanok to their countries. The future of Hanok seems bright, with more orders coming in and women also taking an interest in learning Hanok architecture.
With this global boom, the localization of Hanok to fit their new overseas environment will be the next step in preserving and promoting Hanok culture. 문혜련, 아리랑 뉴스, 고창.
Until tomorrow, heat is expected to continue at an all-time high for September. Seoul's temperature of 35 degrees Celsius will lead to similar heat to today, and tropical nights are expected to continue. Please take good care of your health so that you don't get tired from the heat. Tomorrow there is rain forecast all over the country. Jeju Island will receive up to 120 millimeters, and the Seoul metropolitan area, Gangwon-do province, and the Chungcheong-do provinces will receive up to 60, while other areas are expected to receive 5 to 40. Tomorrow morning will start off at least 24 degrees all over the country. Highs will move up to 35 in Seoul and Daejeon, Daegu, Gyeongju, and Busan 32 degrees. The heat wave is expected to ease off with rain across the country. That's all for Korea. Here are the weather conditions around the world.
That is Newscenter for tonight. Thank you for watching. A panel session coming up.
어느 날 바닷가에 갔더니 제가 촬영했던 화장품 케이스들이 떠내려왔더라고요. 그거를 보고 많은 생각을 했어요. 그 어마어마한 양의 쓰레기는 거의 뭐 상상을 할 수 없을 정도로 진짜 경이로울 정도로 많습니다. 그런 것들이 이제 너무 이질적으로 보였죠. 그 식물들이 거기서 자라고 싶어서 자란 건 아니거든요. 우리가 버린 쓰레기에서 자란 이 식물들도 우리가 만든 환경인데 어떻게 보면 우리가 그 운명에 대해서 관여를 한 거거든요. 우리가 만든 이 환경에 대해서는 인간이 이거를 관여를 해야 된다고 묻잖아요. 내가 이렇게 한다고 해서 이게 달라지는 건 아니거든요, 세상이. 세상에 당신들이 썼던 이런 물건들에서 이 자라는 식물에 대해서 좀 고민을 해봐라. 자연에 들어가서 주변을 잠깐만 관심 있게 둘러보시면 구석구석에 엄청난 쓰레기들이 많습니다. 당신이 하나 주운 게 수천 마리의 종을 생명을 살릴 수가 있습니다. 나는 쓰레기 더미에서 생명을 발견하는 그리너다.
Thanks for joining us. Coming to you live from Seoul, I'm Han-daeun. Today, September 10th, marks World Suicide Prevention Day, a day dedicated to raising awareness about suicide, promoting prevention efforts and supporting those affected by it. Over 700,000 people die by suicide each year, with South Korea having the highest suicide rate among advanced economies. The suicide rate in the United States has also reached a historic high, sparking urgent calls for effective prevention strategies. In today's episode of Within the Frame, we explore recent suicide trends, proactive prevention methods, and what more can be done to combat the rising numbers, focusing particularly on the situation here in South Korea. Joining us now via Skype is Dr. Yoon, director of the He Counseling and Coaching Center. It's great to have you with us.
Thank you for having me.
We're also joined by Michael J. Bernstein, professor of psychology at Penn State Abington, who is with us from Pennsylvania. Welcome to the program.
Hi, thank you so much for having me.
All right, Dr. Chu, let's start off with you. So South Korea showed the highest suicide rate among OECD members in 2022. And according to a local survey, deaths by suicide from January to May this year rose by 10% from the year before. What do you make of this? Are enough measures being implemented?
Yeah, it's unfortunate that despite multiple efforts to prevent suicide, having this high suicide rate, I think, reflects a serious and ongoing mental health crisis in Korea. And I think this serves as an evidence that current prevention measures are not enough and needs to be reassessed and refined. To reduce the suicide death rate, I believe we must enhance our approach in three key areas. One is suicide prevention, also harmful content protection, and promotion of mental health well-being. Currently, many public campaigns and education programs are being offered, but they are overly simplified. Often they rely on one-way lecture or one-size-fits-all approaches to all sorts of groups. This doesn't fully address the complexities of different age groups or contexts. So therefore, these initiatives need to be tailored to meet the specific needs of various populations. Also, protecting vulnerable individuals from harmful online content is important. Algorithms on digital platforms can expose people who are already at risk to harmful suicidal contents. This can include specific and detailed suicide methods or a call for a suicide pact. And there's a shocking stat. Between 2019 and 2023, reports on harmful suicide-related online contents surged almost ninefold, from 30,000 cases to 300,000 cases, according to Ministry of Health and Welfare. So we need also stricter digital safety measures. Lastly, we also need greater emphasis, I believe, on promoting mental well-being. We need programs such as stress management and resilience building, also campaigns to reduce mental health stigma. I think this can help encourage people to have open conversations about mental health and therefore preventing crises before they escalate.
The number of deaths by suicide in Korea in the first 5 months of this year has already surpassed 6,300, which signals that South Korea's alarmingly high suicide rates could increase even further this year. So, as you mentioned, we're going to definitely need more effective measures, more specific measures for different groups of people. Now, Professor Bernstein, the U.S. saw the highest suicide rate last year, with the figure surpassing 50,000, according to the U.S. Centers for Disease Control and Prevention. What's behind this?
It's a great question. Suicide and suicidal ideation, or thinking about suicide are unfortunately all too common. There are lots of causes of this, and largely they focus on a handful of factors, and one of which is people not seeing hope, not believing that things can improve. One major cause of suicide or suicidal ideation is loneliness. This is my area of scholarship. Is people need to feel connected to others. We need to feel like we belong. And when we don't, this can lead to really challenging emotional states and really negative impact on our well-being. Loss of life meaningfulness is another factor when people feel as though their lives don't have meaning. The COVID pandemic led to considerable social isolation, as well as quite a bit of economic hardship and loss of jobs. And people derive often a sense of meaning from their jobs. And so the last several years, of course, suicide and suicidal ideation was an enormous problem before the COVID pandemic. But I believe that the COVID pandemic and the ongoing nature of it are contributing significantly to those statistics now. Another thing in the United States and other countries as well has to do with diverging politics. Many people on both sides of the aisle in the United States feel as though the country that they knew is moving away from them. And this can lead to a sense of a lack of social connection and a loss of meaning as well. And so all of these factors likely relate to the increase in suicide rate in the United States in recent years.
And many reports indicate that youth suicide has increased significantly in the U.S. It seems there's a kind of distress that's toxic to young people that previous generations did not face. And as you pointed out, that those could include sense of hopelessness and loneliness. And we should all try to stay connected, and we can never stress that enough, right? Dr. Chu, the average age of Koreans who died by suicide was 44 years old. How do you analyze suicide rates and patterns by age groups?
The statistics, I think, shows that suicide affects people from all age groups, from all stages of development. According to a recent psychological autopsy of people who committed suicide, it shows people from different age groups committed suicide due to or related to different stressors. Young adults who are below 34 reported their major stressors were related to career pressure and unemployment. Adults who are between 35 and 49, their major stressors were analyzed to be financial burden and work stress, especially related to interpersonal relationship. Adults also between 50 and 64, their major stressors were job loss and retirement. People above 65, they reported the major stressors were social isolation, chronic illness, and depressive symptoms. Something that was missing from this data, but according to other sources, teens, major stressors were related to mental health issues and relationship stress. So you can see that different age groups have their unique and distinct stressors that can potentially contribute to suicide. Therefore, as I mentioned before, in order to have effective suicide prevention strategies, we must address these unique challenges across different age groups.
So major stressors, as you pointed out, of course, vary among different age groups, but it seems that jobs, difficulties with jobs, financial status, trouble in personal relationships sound like some of the common reasons, the common forces that drive people to take their own lives. Now, Professor Bernstein, South Korea's latest suicide data reveals that more men died by suicide than women, with individuals living alone at higher risk. What factors might contribute to this trend, and are we seeing similar patterns in the U.S.?
This is another great question, and yes, we're seeing the same patterns in the U.S. So people in single-person households definitionally have less social connection than people who live together. So they are less connected by virtue of just they live by themselves. This has then two impacts, one of which is it makes it unfortunately easier to engage in self-harm. It's less noticeable when people are behaving differently or giving off signals that they might be thinking of hurting themselves. So there's been a shift in the way that they are experiencing the world. So you have both fewer people around to notice a problem, and people have easier access because there's no one who's living with them who can stop them if they decide they're going to attempt self-harm behavior. Men also tend to have fewer close social connections than women do. And this means they have fewer people to talk to when they need help. And also there are fewer people to notice when they need help. And additionally, men tend to be less comfortable or less willing to talk to others about their feelings, particularly those related to sadness, as these emotions are perceived as not stereotypically masculine. Again, that is not that there is no reason to think this. Men experience sadness, women experience sadness, but men tend to be less comfortable talking about it with others, and as a result are less willing to share that they are having these concerns. All of these make men more likely to engage in self-harm behaviors, and then people living in single person abodes also more willing or more likely to self-harm.
I hope more men can come to realize that it's perfectly normal to reach out and talk about it. It's perfectly normal. There's nothing wrong with reaching out and having an open conversation about their difficulties. Now, Dr. Chu, nearly 97% send warning signals before they take their own lives, yet only about 24% of these signals are recognized, according to the government's latest survey. What are some common signs of suicide, and why do so many people fail to notice them?
Some common signs of suicide can include verbal cues. It could be a direct expression of suicide, such as, I want to die. It can also be a slightly indirect cue, such as, my family would do better without me. Other signs include behavioral signs, such as self-harm or giving away personal belongings, saying goodbye to people, social withdrawal. Also, drastic mood changes can be a sign of suicide. In emotional states such as hopelessness, depressiveness, anxiety, rage, all these can be relevant to warning signs of suicide. As you mentioned, many people, however, fail to notice these suicidal signs. I think one reason may be a lack of awareness. The recent statistics in 2023 show that 47.7% of people believe suicide can occur without any warning signs. Which is not true, but this majority of people, many people, are lacking awareness of recognizing the suicidal signs. Another reason may be a subtlety of suicidal warning signs. For example, something like social withdrawal can be misattributed to like work-related stress or other reasons because these signs are quite ambiguous. It can therefore like something like social withdrawal and drastic mood changes, the severity and the cause can be attributed to different issues such as mental health issues or suicidal warning signs, and oftentimes people have or people struggle to identify them as suicidal warnings. Another reason may be minimization. of the warning signs. When people say like, I want to die, some people minimize it as like, oh, it's probably one of the ways to exaggerate how stressed they are and just brush it off. But it may be warning signs of suicide. Another reason that people miss these warning signs may be fear of intrusion. People may avoid mentioning or talking about suicide or showing care due to fear that other person will feel uncomfortable bringing up the issue, or they might intrude someone's life by mentioning the warning signs. Or sometimes people even fear that asking if they have suicidal thoughts may trigger suicidal thoughts, which is not true.
Professor Bernstein, what steps do you recommend people take when they notice warning signs of suicide in someone else?
So first, I think it's important to remember that the signs can be different in different people and cultures, and everything Dr. Chu said is absolutely right about some of the challenges with noticing these, the ambiguity, the desire to maybe minimize in the hopes that this isn't a problem. I think once we have noticed signals and we are confident or reasonably confident that we get over that barrier of believing maybe this isn't a big deal, maybe I don't have to worry about this, maybe I'm overreacting. I think reminding the person of the importance that they are to friends and family can be helpful, making sure to reinforce that social connection. I think also very practically reminders about avenues for help, such as therapy and suicide prevention hotlines and other sources of support can be extremely helpful. Part of this is normalizing the problem and letting people know that there are avenues of help. Talking to each other can actually be an incredibly helpful avenue to reduce the silence around suicide. As Dr. Chu said, one thing that people are sometimes concerned about is that talking about it will lead to an increase in thinking about it. This is not what we would recommend people try to avoid doing. Another thing that people who are suffering from suicidal ideation and from depression generally worry about is that they are a burden to others, and oftentimes they don't want to share how they're feeling for fear that they're going to burden whomever they're talking to. And so if you are noticing signals, talking to the person about it will relieve that concern over burden, reminding them that you are here because they're not a burden. You are concerned about them. All of these are things that people can do should they notice signals that lead them to be concerned to hopefully support the person in need.
Dr. Ju, a recent survey conducted by a team of researchers at Seoul National University found that nearly half of Korean adults struggle with long-term repressed anger issues. From your perspective, why are people so angry these days? And could this be linked to the country's high suicide rate?
From my perspective, people seem to often feel anger due to perceptions of unfairness and constant social comparisons. When people perceive the society to be unfair, they struggle to find reliable rules or systems that offer a clear path to success. But no matter how hard they work, they may feel nothing is guaranteed. And there often seems to be no alternative solutions or methods to achieve their goals, which leads to helplessness and hopelessness and rage. Also, people are constantly comparing themselves to others, especially through social media, who seem to have more success, wealth, or status, and there will always be someone with more of that, which also fuels feelings of inadequacy and frustration. And I think this persistent sense of unfairness and comparison can lead to deep-seated feelings of anger, not just at a surface level, but to the point where individuals feel helpless and hopeless. And while there may not be a direct link between this rage or anger and suicide. These emotional responses, particularly helplessness and hopelessness, can lead to mental health distress, which is closely associated with an increased risk of suicide.
Professor Bernstein, what measures have been taken by the U.S. government to tackle rising suicide rates? And in your view, what more should be done?
Sure. So the U.S. Department of Health and Human Services has recently come out with their 2024 National Strategy for Suicide Prevention, which is sort of a 10-year plan. This is following on previous plans that had been enacted by the government, and it has 4 facets, one of which is community-based mental health. This is about reducing stigma, having local community members connected to people, so that both people who are feeling this way see local individuals who they may trust as an avenue for talking and for getting support. It also means local community members who know their communities are going to be better at surveillance, at noticing when there are problems. These are people who live and work in the community and therefore are more likely to notice when there is a problem. There is a greater desire to include suicide prevention services as part of regular health care. This is another kind of facet in the U.S. It's very common at hospital or doctor visits to be asked about suicidal ideation, even when the visit has nothing to do with suicide. So someone goes to the doctor for nothing about suicide or suicidal ideation. It's not uncommon for check-ins to occur. This both normalizes the problem, gives a medical professional an opportunity to notice signals that are coming, and also just gives a person the opportunity to talk to someone who has asked how they're doing in this regard. They're also working on more research for suicide prevention and causes of suicide, and then a lot of attention to health equity concerns. So in the U.S. and as in many cultures, there are certain populations that are disproportionately affected by suicide, and the Department of Health and Human Services is directing work and research to focus on looking for health equity within these populations.
And Dr. Chu, just very quickly before we let you go, what is your message to our viewers regarding suicide prevention?
I would like to invite everyone who's watching this to take a part in suicide prevention. Please show care to people around you. Make a call when they show signs of warning signs of suicide. Please don't be afraid to reach out. As Dr. Bernstein mentioned earlier, social isolation is a risk factor, but also social connection can be a protective factor. So please reach out, take care of each other, and please show care to prevent further suicide in our society.
Well, suicide is a complex and deeply personal issue, but it's one that can be prevented with increased awareness and compassion, right? We should all remember that reaching out can make all the difference, and there should certainly be more open conversations about this. Thank you so much, both of you, for your perspectives.
Thank you.
Thank you.
And that brings us to the end of the show. Thank you for watching, and be sure to tune in same time tomorrow to join our conversation. Goodbye for now.
There is no greater blessing than to have good health as you grow old. Even though my mom is over